Hello friends, welcome to my YouTube channel Milliha. Today we are going to discuss in gynecology the second chapter in gynecology. So here is what we are discussing: the physiological changes during pregnancy. Total weight gain. I am going to tell you a few very important points and some diagnostic signs. I am going to also teach you through illustrating some diagrams which I have made by myself. So let's start in a very short time. We are going to discuss a large portion of this second chapter in obstetrics and gynecology. So this is physiological changes during pregnancy. Total weight gain during pregnancy is 11 kg. Montgomery's tubercles are hypertrophied sebaceous glands. So, do you know, students, what is sebaceous gland? It's a oil secreting gland, and the sweat glands do not secrete oils. So, mammary gland is a sweat gland. Okay, breast is a modified sweat gland. So breast secretion can be squeezed at 12 weeks. 12 weeks is about 3 months. At 3 months, breast secretions can be squeezed out. Breast secretion, okay, plasma volume reaches peak at 30 to 32 weeks. In 30 to 32 weeks, the plasma volume in the blood increases to its maximum. At that time, there is a chance of heart failure in the patients of heart disease. Okay, all rise during pregnancy. Hemoglobin, red blood cells, white blood cells, and plasma volume, everything rises in pregnancy. Okay, but hematocrit falls. So HCT is hematocrit. Spun PCV and HCT, they both are same, they are hematocrit. Okay, hematocrit is nothing but percentage of blood cells in the whole blood volume. Okay, that decreases because the volume of the blood increases. Total protein increases, plasma protein decreases. Total proteins also increase, but the plasma proteins decrease. Albumin and globulin ratio reverse. Normal albumin and globulin ratio is 1.1 to 2.5. High albumin globulin disease in liver indicates diseases of liver, intestine, and kidney. So low albumin globulin ratio indicates risk of cancer. Okay, so this is not about gynecology. High albumin ratio and low albumin ratio, but albumin globulin ratio reverses in, that means reverses means the globulin increases. Okay, blood pressure falls due to progesterone. PVC, peripheral vascular resistance, decreases. Peripheral vascular resistance is the pressure uh, exerted on the blood walls by the volume of blood. Okay, that is the it decreases because of the release of progesterone. Cardiac output reaches its peak at 30 to 32 week. Okay, what is cardiac output is how much blood the heart pumps to the body in 1 minute. That is called cardiac output. Cardiac output is equal to stroke volume into heart rate. So stroke volume, what is stroke volume? The volume of blood which a heart pumps in one contraction or in a singular heartbeat, that is called stroke volume. So here it is written, you can see stroke volume, cardiac output is equal to stroke volume multiplied by heart rate. So uterine blood flow is 750 ml per minute at term. How much blood is circulated through uterus is 750 milliliter in 1 minute. So that's why you have to do the cesarean section very fast, because the blood flow is torrential. Okay, hemorrhage, bleeding could damage, cause harm to the patient. Okay, anyway, respiratory rate at vital and vital capacity does not change. So you haven't seen any pregnant woman breathing very heavily and breathlessness. You don't see, because respiratory rate does not change. Okay, total calcium requirement daily is 1 gram. total calcium requirement in pregnancy is 1 gram daily. Okay, milk ejection reflex caused by oxytocin, which is secreted by posterior pituitary gland. Oxytocin is secreted by posterior pituitary gland. Okay, that triggers to secrete the milk. Okay, there's milk ejection, that's called prolactin causes synthesis of milk within breast. In breast, prolactin, this is about, if you don't know about the pituitary gland, so this is pituitary gland, this is posterior pituitary gland, this is anterior pituitary gland, this is intermedia, tuberalis. Okay, this part, and this part is pars distalis. This part, this hole is called anterior pituitary gland, and this stalk, this is called the pituitary stalk. Okay, this is optic chiasma. This place is hypothalamus. Above this there is thalamus. This is the brain. This is in this part of the red part of the brain. There is the pituitary gland is situated. So you can take a screenshot of this image, this diagram. Okay, so if you have taken them, you will proceed. Anyway, you can pause and take. Extra calories required during the pregnancy is 300 kilocalorie, and during the lactation, when the mother is giving milk to the baby, that time she needs more calories than when she is pregnant. So that time she needs 550 kilocalorie. Maximum chance of heart failure in a patient is at 30 to 32 weeks of pregnancy. That I have already told you. Diagnosis of pregnancy, total duration of pregnancy is 280 days or 40 weeks, and total duration of postpartum pregnancy is 294 days or 42 weeks. If it increases more than 42 weeks, then it is a postpartum pregnancy. Okay, post-dated pregnancy is any pregnancy that crosses expected date of delivery. Expected date of delivery, when the child should born, that you should, as a doctor, you should predict it. So, expected date of delivery (EDD) is calculated with the help of Nagel's formula. So, what is Nagel's formula? Is you will add 7 and minus 3 and plus 1. So that I will tell you. 3 months, and you will minus 3 months from last menstrual period. LMP is last menstrual period. So what's last menstrual period is when the first date of the period, the menstruation, when a woman bleeds. The first day, that is called the last menstrual period. After that, she stopped her periods, her menstruation stopped, and it doesn't occur anymore. That's why the first symptom of pregnancy is amenorrhea. Amenorrhea means absence of menstruation or bleeding. In the cycle, okay, so last menstrual period, LMP, suppose is 23rd of July 2021. So you will add 1 year to this, so it will become 2022. Then you subtract 3 months, then it will become 4 April. So then you will add 7 days, it will become 30. So LMP is equal to this. So EDD, expected date of delivery, is plus 7, 3 plus 1. So it will become this 34 2022. She will deliver a baby. That's called EDD. Okay, first symptom of pregnancy is amenorrhea. Pelvic sign, Jacquemer or Chadwick sign, that is dusky hue. Dusky hue means dark coloration of vestibule. Vestibule is where the vagina and cervix and urethra opens. That place is like a place, a pores where it opens, and that is called the vestibule. And anterior vaginal wall. So the color of the vaginal wall, anterior vaginal wall, and the vestibule changes to bluish coloration, bluish purple. So this is the color. I have put an image of the color for you. Exact, you can refer to it as bluish. Okay, so it's bluish coloration, this color. Okay, Osiander sign is pulsation felt in the lateral wall of vaginal fornix at 8 weeks. It is felt at 8 weeks. Osiander means O for octa. Okay, 8 weeks. This sign is seen at 8 weeks. O for octa means 8. H for hexa means 6, 6 to 10. Hagar sign is equal to upper part of uterus contains fetus and cervix feels empty. So in this Hagar sign, the upper part of in the bimanual examination, the cervix becomes soft and the upper part of the uterus is felt. Okay, that is called Hagar sign of pregnancy. So here I have an image and some text written on this Hagar signs. During bimanual examination, the two fingers in the anterior fornix can be approximated to finger of the abdominal hand behind uterus due to softening of the lower part of the uterus and its emptiness, a non-sensitive sign of pregnancy performed during 6 to 8 weeks of pregnancy. So you can take again a screenshot. This is hand, this is uterus. It might be a very faded image, but you can understand for your understanding. This is spinal cord, vertebrae. These are vertebrae. Okay, so this is cervix. These are fingers inserted inside vagina, and this is from upper hand supported from above the abdomen. So this is fetus inside. This is uterus. Okay, so that's it. Piscasec sign is a palpable asymmetrical environment of uterus at 7 to 8 weeks. Other signs are vaginal sign, cervical sign, and uterine sign that you can search and study on Google. Okay, those are not so important, but anyway, I have discussed all the important points here. You can also take screenshots of the points. Radioimmunoassay is earliest to diagnose pregnancy. How early it can diagnose? At 25 days of the cycle. When the cycle starts, and within 25 days you can diagnose the pregnancy. That is very early and very rapid test. Okay, or 9 days of the ovulation. Okay, after ovulation becomes 9 days of, then when ovulation occurs, after that 9 days go, and then you can diagnose the pregnancy. Quickening is felt at 18 weeks in primigravida and 16 weeks at multigravida. Okay, quickening means the fetus moves inside the uterus, inside the womb of the mother. So it's defined as quickening movement of the fetus in uterus. Okay, so primigravida means a woman who is pregnant for the first time. She is called primigravida, and a woman who is pregnant for multiple times is called more than one time is called multigravida. So in a woman who was pregnant even earlier, the quickening is felt earlier because there is a large space inside the uterus. But in the primigravida, the space is less, so the quickening is felt later on. Anyway, best time for the USG in pregnancy is 18 to 20 weeks, and it is called level 2 scan or anatomy scale for major congenital anomalies. It is also called anatomy scale or anomaly scan. Okay, level 1 scan is done at 6 to 14 weeks for position of placenta, for volume of amniotic fluid, and any birth defects, and size of maternal pelvis. On the basis of the size of maternal pelvis and the measurement of the size of maternal pelvis, the surgeon or the gynecologist or obstetrician decides whether we should have a surgical delivery or a simple delivery. Anyway, CRL, what is CRL? Is crown rump length. Crown rump length. So it's important to estimate the gestational age. What is gestational age? When was the baby conceived? Then how much time has passed? That is called the gestational age. That means you can say for how long the mother has born the baby inside her womb. Okay, that is gestational age. So its gestational age is CRL plus 6.5. So suppose this is crown to rump length, you can measure through ultrasound like this. So suppose if this is 50 ml, it is measured measured in millimeters. So if it's you will convert it into centimeters. 10 millimeters make 1 centimeter. So in this case it will become 5 centimeters. 5 plus 6.5 is equal to 9.5. So about 10, uh, 5 plus 6 6.5 is 11. Okay, 11.5. So it's about 11 weeks baby. If it is 50 millimeter, the CRL, if crown to rump length is 50 millimeter, then the gestational age is about 11 weeks. So it's the used in the first trimester to calculate the gestational age, but in the second trimester the biparietal diameter is used to determine the gestational age in second trimester. So what is biparietal diameter? Is this diameter, okay, this diameter, but this is called occipitofrontal diameter. Okay, so you will study these diameters and diameters of a pelvis later on in another chapter, but here this much is enough. You can take a screenshot of this for memorizing later on or for making your notes. So for example, if the crown rump length is 34 millimeter, okay, 10 3.5, so plus 6.5 is equal to 9.5 is equal to 10 weeks. Okay, crown to rump length at 7 weeks is 10 millimeter. At 7 weeks, the crown to rump length at 7 weeks is 10 millimeter. Few things, these things you should remember because they can ask you in your exam. So at first trimester, CRL is important fetal feature, as I have told you. Second trimester, biparietal diameter is important, fetal weight and gestational age. During third trimester, the important parameters are femur length, abdominal circumference, and head circumference. Okay, in the third trimester, to estimate the gestational age, is the important criteria are femur length, abdominal circumference, and head circumference. Appearance of the ossification centers in femur and tibia is at 40 weeks. Okay, TVS, transvaginal sonography, and USG of abdomen. In USG or through abdomen, you can always see 1 week later, a week later than transvaginal sonography, because when the sonography is done through the vagina, you can see earlier, you can diagnose earlier. So gestational sac you can see at 5 weeks, and in USG you can see at 6 weeks. Cardiac activity you can see at 6 weeks and 7. Here in USG you can see at 7 weeks. So fetal heart rate Doppler you can see at 10 weeks. So in ultrasonography USG, some doctors, some sonographists can see, uh, can hear the fetal heart rate at 5 months or after 5 weeks, or after uh, 6 weeks, maybe after exactly after 7 weeks. So but here through Doppler you can hear the uh, sound of the heart of the baby at 10 weeks. Okay, detectable fetal breathing movement starts from fifth week. Okay, at fifth week means 1 month and 1 week, 1 month and 1 week. So at 1 month and 1 week, you can see, you can detect the fetal breathing movements. In this breathing, the fetus does not exchange carbon dioxide and oxygen, because carbon dioxide oxide and oxygen is supplied to the fetus by the umbilical cord, by mother, from the blood of the mother. But he just practiced this to develop his lungs and make space inside his thoracic cavity. So but the breathing movements start at fifth week of the gestation. So don't be confused about this. If you might think that why should there be breathing inside the womb when there is a fluid? So these in there is breathing movement, but there is no exchange of carbon dioxide, oxide and oxygen. Third trimester they don't exchange oxygen during breathing, rather required to the umbilical cord. Earliest congenital anomaly to be diagnosed via TVS at 8 to 10 weeks of pregnancy in an anencephaly. What is anencephaly? Is absence of head. Absence of head. If there is a congenital anomaly, a gross congenital anomaly, like a horrible one, like absence of head, then you can diagnose. This is the first anomaly to be diagnosed through TVS, transvaginal sonography, at 8 to 10 weeks. Thank you very much for listening to me. And this is Miliha. Revise and study. We will study another chapter in the next video. Thank you. Good night.